Why hiccups happen, symptoms, causes, and how to stop them fast. Have you ever been perfectly fine? Then suddenly, hic, every few seconds. And no matter what you do, it just won't stop? Most people think hiccups are harmless. But did you know persistent hiccups can signal serious medical problems? Today, we'll break down what hiccups really are, common and dangerous causes, symptoms you should never ignore, and simple, science-based ways to prevent them. Stay till the end. You might be surprised how much your body is trying to tell you. Subscribe for simple medical explanations you can trust. What are hiccups? Hiccups are sudden, involuntary contractions of the diaphragm, the main muscle that helps you breathe. When the diaphragm contracts suddenly, air rushes into the lungs. The vocal cords snap shut. That produces the classic hic sound. Medically, hiccups are called singultus. They are usually temporary, harmless, self-limiting, but not always. Common symptoms of hiccups. The most obvious symptom is repetitive hic sound. But hiccups can also come with sudden chest jerks, mild chest or throat discomfort, abdominal tightening, difficulty speaking smoothly, interruption of eating or sleeping. When hiccups become concerning, last more than 48 hours persistent hiccups, last over 1 month intractable hiccups. At this point, they are no longer normal. Common causes of hiccups. 1. Stomach and digestive causes. This is the most common category. Eating too fast, overeating, spicy or hot foods, carbonated drinks, alcohol, sudden temperature changes in food. These irritate the diaphragm or nearby nerves. 2. Nerve irritation. Hiccups involve 3 key nerves: phrenic nerve, vagus nerve, brainstem centers. Irritation can come from acid reflux, GERD, goiter, ear wax touching the eardrum, throat infections. 3. Emotional and psychological triggers. Yes, your mind can trigger hiccups. Sudden excitement, anxiety, stress, shock or surprise. This explains why hiccups sometimes start out of nowhere. 4. Medications. Some drugs can cause hiccups. Steroids, benzodiazepines, chemotherapy drugs, opioids, some anesthesia medications. 5. Serious medical causes. Persistent hiccups may signal stroke, brain tumors, meningitis, kidney failure, liver disease, diabetes complications, chest infections, heart attack, rare but possible. Never ignore long-lasting hiccups, especially with headache, weakness, vomiting, chest pain, weight loss. How to prevent hiccups. Everyday prevention tips. Eat slowly. Avoid overeating. Limit fizzy drinks. Reduce alcohol intake. Avoid sudden temperature changes in meals. Manage acid reflux. Breathing and diaphragm control. These help reset the diaphragm. Slow deep breathing. Holding breath briefly. Breathing into a paper bag, short duration only. Posture and lifestyle. Sit upright after meals. Avoid lying down immediately after eating. Maintain healthy body weight. Manage stress and anxiety. Medical prevention for chronic cases. Doctors may prescribe acid-reducing medications, muscle relaxants, nerve-targeting drugs, only under medical supervision. When to see a doctor. See a doctor if hiccups last more than 48 hours, interfere with sleep or eating, are associated with pain, vomiting, or weakness, occur repeatedly without clear cause. Early evaluation can prevent serious complications. Hiccups may seem small, but your body never does anything without a reason. Listening early can save you later. Like this video if you learn something new. Share it with someone who gets frequent hiccups. Subscribe for weekly health content made simple. Comment below. Have you ever had hiccups that wouldn't stop?
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.